After the age of 70, some health checkups can actually do more harm than good. There's a hidden reality most older adults are never told. Every year, millions of seniors line up for routine medical tests, believing they're protecting their health. But what if some of those very tests are quietly increasing the risk of surgery, stroke, or even cancer? New research shows that up to 37% of medical tests in older adults lead to unnecessary treatments, complications, or lifelong side effects. Even more alarming, nearly 99% of people over 70 don't realize they're being over-tested. One test on today's list, the number one, has been linked to 5% of all cancer cases in the United States, the same level of risk as daily alcohol consumption. You won't hear this in most clinics. You won't see it on billboards, but the truth is buried in the science, and today we're exposing it. In this video, we'll reveal 5 health checkups you should avoid after 70 and the disturbing truth about what they can really do to your body. Everything is backed by real scientific evidence, and wait until you hear what landed at number 2. Before we begin, tell us in the comments where you're watching from, your age, and whether you've ever regretted a medical test or procedure. Do you think seniors are tested too often? We read and respond to every comment with personalized tips and advice. And don't forget to like this video and subscribe for more eye-opening content like this. Now let's begin with the first test, one that seems harmless, but can quietly destroy your quality of life. Checkup number 5, bone density scan. At number 5, the bone density scan. It sounds simple. No pain, no needles, just a quick scan to see how strong your bones are. But after age 70, this test often creates fear instead of protection. Known as a DEXA scan, it measures bone strength and is used to detect osteoporosis. The problem is that in older adults, especially women, results almost always show lower bone density, even when there's no real danger. Bone loss is a natural part of aging, just like gray hair or wrinkles. Yet many seniors are immediately placed on medications like bisphosphonates, which are meant to strengthen bones but come with serious risks. These include jawbone necrosis, a rare but devastating condition, along with esophageal irritation and digestive problems. Here's the key issue. Studies show that treating mild bone loss in people over 70 barely reduces fracture risk. A major study in the Journal of the American Geriatric Society followed over 1,200 women over 70 and found fracture reduction of just 0.3% after 5 years. Meanwhile, side effects were common and often severe. Take Rose, a 76-year-old retired piano teacher. She was active, walked daily, and had never fallen. After a routine DEXA scan showed mild bone thinning, she was prescribed medication. Within months, she developed severe reflux and jaw pain and stopped playing piano altogether. After stopping the medication, she focused on vitamin D, strength training, resistance exercises, and a calcium-rich diet. A year later, she was performing again, stronger, steadier, and fracture-free. For seniors who aren't falling or breaking bones, lifestyle changes reduce fracture risk far more effectively than medication. A 2022 study found strength training, balance work, and nutrition reduce fractures by over 20%. Don't let a number on a screen scare you into treatment you may not need. And coming up next is a scan that can lead to something even more frightening: brain surgery. Checkup number 4, brain MRI for memory loss. Number 4 is the brain MRI for mild memory problems. Forgetting names or misplacing keys can feel terrifying, and fear often drives doctors to order brain scans. But here's the uncomfortable truth. Most MRIs in seniors don't provide helpful answers. Instead, they usually show age-related changes, normal brain shrinkage, or white matter spots that are common in older adults. The danger is what happens next. Once these findings appear, they often trigger fear, more tests, and even unnecessary procedures. A 2021 review of over 3,000 MRs in adults aged 70 to 85 found that 86% showed abnormalities, yet only 3% were linked to treatable conditions. Nearly 12% of patients were sent for invasive procedures, all based on unclear scan results. George, a 74-year-old retired engineer, had an MRI after mild forgetfulness. The scan showed white matter changes. He panicked, stopped driving, stopped socializing, and became anxious. Later testing revealed his memory was completely normal for his age. Once reassured and guided toward better sleep, hydration, and mental activity, his confidence and memory returned. Unless there are serious neurological symptoms, such as seizures, rapid decline, or personality changes, MR is rarely helped with mild memory loss. Simple cognitive screening tests are often safer, cheaper, and far more useful. Now brace yourself, because the next test is one almost everyone has heard of. Checkup number 3, cardiac stress. Test number 3 is the cardiac stress test. Often ordered for mild fatigue or vague discomfort, this test is designed to detect blocked arteries. But in adults over 70 without clear heart symptoms, it frequently leads to false alarms. Studies show false positive rates as high as 40% in seniors. That means many people are sent for invasive follow-ups like angiograms, stents, or bypass surgery, procedures that may offer no benefit. A major JAMA cardiology study found that over half of stents placed after stress tests were done in patients with no improvement in survival or quality of life. What they did experience were complications like bleeding, kidney injury, and long hospital stays. Raymond, a 75-year-old daily walker, mentioned feeling tired on hills. A stress test led to a stent placement. He later suffered kidney damage from contrast dye and spent nearly a week hospitalized. His fatigue never improved because it was never a heart problem. For most seniors, safer alternatives like a resting EKG or coronary calcium scan are often better first steps. And now number 2, the test that surprises almost everyone. Checkup number 2, colonoscopy. After age 70, and especially after 75, routine colonoscopy often carries more risk than benefit. Preparation involves harsh laxatives that can cause dehydration and kidney issues. Sedation can affect brain function, and the procedure itself carries risks of bleeding and bowel perforation. A massive 2019 study of Medicare patients found that for every 1,000 colonoscopies in people over 75, only 2 lives were saved, while over 20 suffered serious complications. Dana, a healthy 73-year-old grandmother, underwent a routine colonoscopy despite no symptoms and previous clean results. A small polyp was removed. That night, she suffered a bowel perforation and spent 9 days in recovery. Current guidelines recommend stopping routine screening at 75 for most people. Safer options like at-home stool tests often provide enough protection without the risks. And finally, the most overused and most dangerous checkup of all. Checkup number 1, annual full-body CT scan. Full-body CT scans are marketed as life-saving, but the truth is chilling. These scans expose the body to massive doses of radiation and trigger countless false alarms. Each scan delivers radiation equivalent to hundreds of chest X-rays. A 2023 study found CT scans may now be responsible for up to 5% of all cancers in the U.S. Marcus, an active 80-year-old, underwent a full-body scan that detected a tiny harmless nodule. What followed were more scans, a biopsy, and a collapsed lung. The nodule was benign, but the damage was real. Medical experts agree full-body CT scans should never be used for general screening in healthy adults. There is no proven benefit, only risk. Final thoughts. These 5 checkups may seem protective, but after 70, they can quietly cause harm. Medicine is powerful, but sometimes less truly is more. Always ask, what happens next if this test finds something? If the risks outweigh the benefits, it's okay to pause. Real prevention comes from movement, nutrition, sleep, and thoughtful care, not fear-driven testing. Now we'd love to hear from you. Have you or someone you love experienced complications from an unnecessary test or treatment? Share your story in the comments. Thank you for watching, and take care of your health wisely.